Peace and greetings to you. My name is Omar Abdul Malik. I'm a physician assistant practicing in Washington, D.C. I have a clinical conundrum that I wanted to just kind of issue to the public. I've been very concerned about this Cosby case. I grew up on Cosby in the 80s. You know, I'm a Generation Xer, so I grew up on the Cosby Show and Dr. Huxtable. One of the reasons why I became a clinician is because of that show. I believe it had a very strong impact on me. One of the reasons why I wanted to go to an HBCU, historically black college and university, was because it's a different world, you know, which Dr. Cosby produced. So it really disturbs me, these allegations that have been made about him. I hope that they are not true, but the evidence is starting to not look too good in his favor. But one of the things that disturbs me is the possibility that there is a clinician, or clinicians, plural, somewhere who provided him with prescriptions for Quaaludes, possibly suspecting what he was going to do with them. Who knows? But I guess one of my questions is, to what degree do clinicians, or to what degree is the clinical community to be held accountable when patients do things that are harmful to themselves, are certainly harmful to others, and they needed the help of clinicians? A doctor, PA, possibly nurse practitioner, possibly wrote prescriptions for Quaaludes so Mr. Cosby could get them. And I foresee a clinician somewhere in his past being brought to light, being brought to court, you know, cross-examined, you know, prosecuted, you know, did you know what Mr. Cosby was going to do with those Quaaludes when you wrote the prescription? You know, what did you give him to him for? Oh, he had insomnia? Oh, he had depression? Oh, he had this, he had that? Well, what are your credentials? Where did you go to school? How long were you licensed? Were your license ever challenged? So then, you know, now some clinician is sitting up there in court like, hey, I didn't do anything wrong. What are you guys coming after me for? And we see so many cases like this in the media. And unfortunately, because media has got to sell their shows and their papers and so forth, the more famous the person is, the more scrutiny anyone who is surrounded that person, the more scrutiny they're going to come under. You know, the Michael Jackson case, as tragic as his death was, and I know they're two totally different cases, but as tragic as Michael Jackson's death was, like what happened to his clinician. That guy is done. I mean, he will never, I don't think he'll ever be able to practice medicine ever again. And there's other cases that are similar to that. Other people who have died, or they've brought harm to themselves or others, and it trickles back down. Or makes it look like it's trickled back down to the clinician. So my question to you, the viewing public, is to what degree should clinicians be held accountable, or to what level should they be seen as complicit in the activities that their patients do, you know, when they harm themselves or the public? Should they be prosecuted? Should they be punished? Should their licenses be taken away, even if they didn't know what the person was going to do? I look forward to this discussion, and hopefully having a discussion with you all, the public. Please try to refrain from any use of profanity. Thank you. Peace.